Hi, welcome back. In this section, we're going to be learning about the nerves and the blood vessels of the heart muscle itself. And so let's start with the arterial blood flow. And by the time we're done, you should be able to come back and look at this heart and know what the name of, for instance, this blood vessel is and this blood vessel over there. So the blood to the heart comes from two blood vessels which originate just above the aortic valve. So this is a picture down here where we're looking at the left ventricle with the mitral valve. And here is the aortic valve with its three cusps. And we have two openings to the two blood vessels bringing blood to the heart muscle itself. So the first blood vessel is called the right coronary artery. And when it exits the ascending aorta, it travels in a groove which is located between the right atrium and the right ventricle on the external surface of the heart. And you can clearly see in an angiogram a beautiful right coronary artery. So it travels anteriorly and then it will circle around to the back side of the heart. And then the second blood vessel is going to be called the left coronary artery. But the left coronary artery is a little bit different. If you recall, the left side of the heart has thicker muscles, so it has a higher oxygen demand. And so one little blood vessel cannot do the entire huge left ventricle. And so this blood vessel comes out of the aorta and is behind the pulmonary trunk, and then right around the time you can see it anteriorly, it will divide. And we will have one blood vessel which continues down in the groove between the two ventricles all the way to the apex of the heart. And that is going to be called the left anterior descending artery. So the name kind of makes sense. And then the other blood vessel goes around the outside of the left side of the heart to the back side of the heart. That is called the circumflex artery. So the bottom right picture shows all the coronary arteries. You have the right coronary artery going between the right atrium and the right ventricle. You have the left coronary artery behind the pulmonary trunk. And then between the right ventricle and the left ventricle, you have the left anterior descending artery. And then between the left atrium and the left ventricle, you have the circumflex artery. So we use the word coronary for arteries, but we use the word cardiac for veins. And we're only going to learn one vein. And this is the vein that drains most of the blood from the heart. So it starts down here at the apex of the heart. So do you know what blood vessel this is here in white, carrying blood down this direction? Do you remember from the previous slide? That's right, it's the left anterior descending artery. So right next to it, we have a vein carrying blood in the opposite direction, known as the great cardiac vein. And in some pictures, it'll show it coming up here and then taking a right-hand turn to travel with the circumflex, but usually it cuts off the corner like in this drawing. And so the great cardiac vein goes the opposite direction of the left anterior descending artery, and then it continues the same direction as the circumflex artery towards the back side of the heart. And then on the back side of the heart, there are other veins that are going to start draining. And as soon as you see other veins posteriorly draining into it, we're no longer in the great cardiac vein. We are in this big structure, which does not have the normal anatomy of the three tunics. So we're not calling this a vein anymore. We are back to that word sinus. And unfortunately, we're using the word coronary sinus instead of cardiac sinus to represent that it's venous blood. And so this is the coronary sinus, which you can see in the groove posteriorly between the left atrium and the left ventricle. And blood flow is going from the left side towards the right side. And so right here where it's disappearing into its opening in the right atrium, just above the tricuspid valve and just below the foramen ovale. And so that opening of the coronary sinus is draining all the venous blood from the heart, because you can see the veins from the right side of the heart also drain into it as well. So that's it for blood flow. And now let's talk about the innervation of the heart, the conduction system of the heart. And there are 6 parts, but really 5 divisions for this. The first is right near the opening of the superior vena cava to the right atrium, and it is known as the sinoatrial node, which is sometimes abbreviated SA node, but you do need to know the word sinoatrial node. And from there, impulses will spread until they reach this, which is right above the tricuspid valve, and it is known as the atrioventricular node, sometimes abbreviated AV node. From there, impulses will travel through what is known as the bundle of His, and this is in the interventricular septum, where it splits into 2 pathways. The one on the right is called the right bundle branch, which travels down towards the apex of the heart, and then actually comes up on the outer wall of the heart. And we have a similar one, a left bundle branch traveling through the interventricular septum, which goes to the outer wall. And it's not just one strand that's doing that, because it comes down the bundle, and then we're going to have it branching into many parts coming up the outer wall. And coming off the bundle branches, we have all these little branches going to the actual heart muscle cells, those cardiomyocytes themselves, and these are known as the Purkinje fibers. So how does this work? Well, the cells basically look like normal muscle cells. They're just slightly larger, and not only do they have muscle cell anatomy, they have some neural properties. They can send action potentials. And those intercalated discs, they're really important because they will allow a quick spread of the impulse. So whatever is happening as far as sodium influx or potassium efflux in one cell is going to, if sodium is pouring into this cell, then the sodium in this cell will pass through the gap junctions, and the sodium concentration in this cell will go up, and it will depolarize almost immediately as well. And so the entire cardiac cycle is going to be started by that sinoatrial node, and it will spread over both atria through these various pathways that you see here. So it goes, and then the 2 atria are all innervated at one time. Then the impulse hits basically the fibrous skeleton where this atrioventricular node is located, and it gives us a momentary delay, which allows those atria to contract and empty before we're going to start contracting the ventricle. So the atrioventricular node sends a new impulse through the bundle of His and through the right and left bundle branches and into the Purkinje fibers, and you can see the papillary muscles are even innervated with the Purkinje fibers. And so the impulse travels in a downward area towards the apex of the heart. And then contraction actually starts at the apex of the heart and then goes in an upward direction. So if the heart is like this, this is contracting first before this. And so now you should be able to understand why blood is going in an upward direction through the pulmonary trunk and the ascending aorta. So the thing about the heart is it has its own intrinsic rhythmicity. There are cranial nerves and spinal nerves that affect the concentration, but it decides whether or not it wants to contract. And so when I say other nerves affect the contraction, this is showing both parasympathetic innervation as well as sympathetic innervation. So let's look at this a little bit closer. The parasympathetic innervation comes from the vagus nerve, or the 10th cranial nerve, represented here in purple. And what you can see is the innervation goes to both the sinoatrial node and the atrioventricular node. In contrast to this, sympathetic innervation comes through the sympathetic chain like you would expect, and it goes, yes, to the sinoatrial node and the atrioventricular node, but it also goes to the ventricular muscle cells themselves. So when we're looking at neurotransmitters affecting the heart, the parasympathetic nerves of the vagus are going to involve acetylcholine, whereas the sympathetic thoracic nerves are going to involve norepinephrine. So norepinephrine can affect the ventricles and the atrium, but acetylcholine has only to the SA and AV nodes in the atrium, right atrium. And with that, we are done, and I will see you again shortly as we continue our exploration of our amazing hearts. Thank you for all your hard work.